So median nerve is one of the important nerves of the upper limb. It can come as an LAQ, short question or a clinical case. The most common clinical case asked is carpal tunnel syndrome. Now let's learn the median nerve, its course, branches and distribution. So as we all know, median nerve has the root value of C5 to C8 and T1. Median nerve is formed by the union of lateral root of median nerve and median root of median nerve. Lateral root of median nerve comes from the lateral cord of brachial plexus and medial root of median nerve comes from the medial cord of brachial plexus. Now let's see its course. In arm, it is first lateral to brachial artery. In mid-arm, it crosses brachial artery lateral to medial. As we can see here, it crosses the brachial artery and this happens at the level of insertion of coracobrachialis muscle. Now, in the lower arm, it is medial to brachial artery. In the cubital fossa, it is the most medial content. From medial to lateral, we can see the relations: median nerve, brachial artery, tendon of biceps brachii and superficial branch of radial nerve. The mnemonic is MBBS. Median nerve, brachial artery, biceps brachii tendon and superficial branch of radial nerve. You can write this as a heading like relations in cubital fossa. Now, after leaving cubital fossa, it passes between two heads of pronator teres and supplies it. Now the median nerve gives a branch called anterior interosseous nerve. It is a deeper branch of median nerve and it supplies three muscles: flexor digitorum profundus, its lateral half, flexor pollicis longus and pronator quadratus. And main median nerve, it supplies flexor carpi radialis, palmaris longus and flexor digitorum superficialis. Before flexor retinaculum, it gives a palmar cutaneous branch. As we can see here, this palmar cutaneous branch, it is given before flexor retinaculum. And compression of median nerve in flexor retinaculum gives rise to carpal tunnel syndrome. We will discuss that later. Now let's see the branches of median nerve and its distribution in the hand. Median nerve in hand gives two divisions, lateral division and one medial division. Now lateral division, it supplies L1 lumbrical and thenar muscles. Thenar muscles are opponens pollicis, flexor pollicis brevis and abductor pollicis brevis. And the medial division, it supplies L2 lumbrical and it gives digital branches. Cutaneous supply for lateral 3.5 finger for the palmar aspects along with nail beds. Now we have seen here the course, distribution and branches of median nerve. Now let's just quickly revise which muscles are supplied by median nerve. Now let's see the muscles supplied in the forearm. These are pronator teres, flexor carpi radialis, palmaris longus and flexor digitorum superficialis. Now anterior interosseous nerve, its deeper branch, it supplies three muscles: flexor digitorum profundus, lateral half, flexor pollicis longus and pronator quadratus. Muscles supplied in hand are lateral division supplies L1 lumbrical, opponens pollicis, flexor pollicis brevis and abductor pollicis brevis. Medial division only supplies L2 lumbrical, but it gives cutaneous branches to lateral 3.5 fingers of palmar aspect along with nail beds. This was an important point, that's why I included it here. So now let's see the median nerve injuries. So there can be two possibilities. Median nerve can be injured here or here. Here it is injured due to supracondylar fracture of humerus or pronator teres syndrome. That is, the nerve gets compressed between the two heads of pronator teres. Or it can get compressed here under the flexor retinaculum. That is called a carpal tunnel syndrome. So first let's see the pronator teres syndrome. One, we can see there is an ape thumb deformity in which the thumb is unopposed, extended and adducted. The thumb is unopposed because of paralysis of opponens pollicis, It is extended because of paralyzed flexor pollicis brevis and adducted due to paralyzed abductor pollicis brevis. Now the next deformity seen is pointing index finger. Now while making a fist, the index finger and middle finger can be pointed, and it is also called benediction hand, cannot flex middle and index finger. And this is due to paralysis of FDS, that is flexor digitorum superficialis, and FDP, lateral half of FDP. FDP is flexor digitorum profundus. These are the flexors of fingers. Third deformity seen is supine forearm because pronators are paralyzed, and adducted hand because flexor carpi radialis is paralyzed and there is weak flexion of wrist. Now let's see what happens to the cutaneous supply. There is sensory loss on the lateral 3.5 palmar surface of hand and lateral 3.5 fingers on the palmar surface, including nail beds. Now let's see what happens in the carpal tunnel syndrome. It is a lower injury, that's why only some muscles are affected, not all, like we have seen in the pronator teres syndrome. First is ape thumb deformity. We can see there is unopposed extended and adducted thumb, and there is sensory loss on the lateral 3.5 fingers on palmar surface, including nail beds. But what is spared in this? Pointing index finger is absent because FDS and FDP, that is flexor digitorum superficialis and flexor digitorum profundus, lateral half is spared. There is no sensory loss on the lateral 3.5 palmar surface of hand because palmar cutaneous branch is spared. As we have seen here, palmar cutaneous branch is given before entering the flexor retinaculum. That's why sensory supply on the palm is spared. Next we have some tests here which are performed to diagnose carpal tunnel syndrome or median nerve injury. So first one is Froment's sign or book holding test. We have to tell the patient to hold a book in his 2 fingers, but the patient is unable to hold the book. Similarly, there is a paper holding test. The patient is unable to hold paper with thumb and other fingers. And last one is Phalen's test. It is the most commonly done test. Acutely flexed wrist causes pain in carpal tunnel syndrome. We have to flex both the wrists and keep it in the flexed position for 30 to 60 seconds. This causes severe pain if the patient has carpal tunnel syndrome. I hope you enjoyed this video and you understood every concept of median nerve, its roots, branches, cutaneous supply, muscular supply, everything, carpal tunnel syndrome and pronator teres syndrome, and all the signs we have seen here. If you like this video, please like, comment, share and subscribe to this channel. Thank you.